The Child Rights or National Program of Action for Children, NPAC, has been strategically placed to drive national decision-making processes for reforming laws, policies and practices, and their access to diverse stakeholders, which is fundamental in monitoring, reporting, and in awareness raising. Following a thorough review of the initial report by the committee in 2016, concluding observations and recommendations were submitted to Zimbabwe, for implementation. So, allow me to bring to your attention that the government of Zimbabwe continues with efforts to put in place concrete strategy to translate constitutional provisions into reality in terms of aligning the different interpretations in the definition of a child and setting the minimum age of criminal responsibility. And the alignment processes also seeks to harmonize marriage laws in Zimbabwe and bring the governance of marriages under a single act. The proposed Education Act Amendment Bill seeks for the provision of the progressive realization of the right to a basic state-funded education. Zimbabwe has made positive efforts to create an enabling policy environment for the improvement of public health. And this has been done through the National Health Strategy for Zimbabwe, starting from 2016, ending in 2020, and a robust HIV response strategy, which seeks to achieve equity and quality in health, leaving no one behind. The HIV strategy includes domestic resources mobilization through the AIDS levy to ensure sustainability. The government of Zimbabwe continues to enforce the policy of not charging user fees to expecting mothers and children under the age of 5 years. And blood and some of the essential drugs are provided for free of charge. So the 2017 Intercensal Demographic Survey estimated a maternal mortality ratio of 525 deaths per 100,000 live births. This is a decline from the 2015 survey estimates of 651 deaths per 100,000 live deaths. And in accordance to the 2015 Demographic Health Survey, child mortality rate has dropped to 69 from 84 in 2010. So the maternal mortality rate dropped to 651 in 2015 from 960 in 2010. So these are very huge improvements in the performance of health status indicators, were largely due to increased investment in the health sector, especially for women, children and adolescents by the government and its partners.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.